Hi, let me introduce myself. My name is Frances. I came into contact with David, the implant guy, via my own dentist a number of years ago. I was experiencing some problems with a bridge. I'd had a bridge for many years, and the bridge had become very old and fractured, and we knew that sooner or later the whole thing was just going to pack up. And so the options were fairly stark. So it meant that either I had to have, it became clear that another bridge was not going to work. And so I either had to live with having a big gap on my top left-hand jaw, or my dentist said, well, perhaps you should consider having some implants done. And so I decided to pursue that possibility and find out more about it. And my dentist said he was working closely with David, and they'd done so for a number of years. I also had the experience of my own sister who'd had an implant, not with David, but in another surgery, and she was slightly apprehensive about it, but I think hers was a bit different to me. Anyway, I did the research. I was given lots of information by David, lots of things to think about, and he mapped out very accurately for me what course the treatment would take, and so I eventually decided to go for it, and so we initiated the process 4 years ago. So when David started investigating the particular issues in my mouth, it became clear that he would have to do what they call a sinal lift. So that's lifting a flap of the sinus to go in there. So if you like, that was an extra hassle that a lot of people wouldn't have to go through. But I did because of the nature of my the bones around my sinus. So we did that part of the procedure in his surgery in Milton Keynes, and it all went absolutely according to plan. I can't deny it was a bit uncomfortable at the time, because that was the trickiest part of the procedure. And so, he'd warned me to expect a bit of bruising afterwards, and obviously there was a healing process for the sinus to go through, because effectively it was surgery and it was quite invasive. But once we came through that period and it all healed up, because it took quite a few months, and that's normal for it to take a few months for it to heal, we then got on with the subsequent stages in the procedure, and everything went absolutely according to plan, and absolutely no problems anywhere. And so, other than that first stage where, it was uncomfortable because it was an invasive procedure, I can't really complain of any other discomfort. Obviously, once you've had the implants put in, if they're going into an area of your mouth where you've become used to having gaps, because I'd had the bridge removed, then it does feel strange initially when something is occupying that gap, and it does feel like a foreign body, because it is a foreign body. But it's amazing really how quickly your brain gets accustomed to something else being there, and something which in my case feels as if it's always been there. It feels fairly permanent, and so it just feels like they're my own now. Feels exactly the other side, the same as the other side of my mouth. And so, I'm perfectly happy I use that side of my mouth where the implants are exactly the same as I use the other side. I did go a bit cautiously initially because it was all new. You're worried about putting pressure on it and maybe chewing too hard and so on. But over time, all of those, if you like, fears and apprehensions, they've gone. And I just, chew away on that side as much as I do chewing away on the other side. So I would, then there may well come a point in the future where I have to have another one done on the other side, and quite frankly I wouldn't hesitate to have it done again, because because it's just made such a big difference, and you know, it's something which is permanent as well. So I would recommend it, but I can understand why people would need to stop and think carefully about it, and why people might be a bit apprehensive, as was I. But you know, I was in good hands, and I was well taken care of right through the process. And yeah, so if you decide to go down the same route, I wish you the best of luck, and I'm sure you'll be very happy with the result. I certainly am. And well, I've almost forgotten the initial part, which was the uncomfortable part, but it's worth it in the end. It really is. So best of luck if you decide to go for the procedure. Thank you. Bye.